public sector as a whole is facing a fundamental challenge. The combination of constrained resources, increasing demand for services, and also increasing complexity of the public service landscape means that the existing tools, existing mindsets, existing structures aren't going to be sufficient. Demand management has emerged in the context of local government as a response to this. At its root, it's about tackling pressures on services that are avoidable or preventable in some way. It's about improving outcomes for people in the context of constrained resources. What our chapter looks at is the connections between this and prudent healthcare, where we think that there is a large degree of overlap between what demand management is seeking to achieve and what prudent healthcare is seeking to achieve. And we draw out two areas where we think there's an opportunity for learning across demand management and prudent healthcare, or more generally across the public sector. One is around the fostering of innovation and the spread of good practice, where we have some ideas about how it works, but we really don't have a good model for encouraging the spread of good practice. And that's something where prudent healthcare and the healthcare system generally can contribute, but also learn from attempts elsewhere to tackle that. And the second issue is around achieving systemic change, where there are issues being faced by the public sector and by service providers, which are interconnected, where tackling them requires action not just from the health service, not just from education providers, not just from local government, but from a coordinated effort of all public agencies. And actually, in some cases as well, it requires culture change, changes in public attitudes and behaviour. In our chapter, we distinguish between need for services and demand for services. Meeting need is, under our definition, appropriate provision of a service. But meeting demand for a service is actually an inefficient use of the resources available. But we need to get better at understanding what is driving demand and what the patterns of demand are. And so there's a lesson there for the NHS, but also for the public sector as a whole. Tackling the pressures that the NHS are facing at the moment requires action across the public sector. It's about the NHS working with other public sector organisations